This Good to Go segment is sponsored by Spectrum Health Medical Group.
As the practice of healthcare continues to change and evolve, more and more care is delivered in the home. Here to tell us more about that trend is Steve Mcneely. He is Executive Director of Home Care Operations, Spectrum Health at Home. And it's good to see you, Steve.
Thank you. It's good to be here.
I imagine that COVID has allowed all of us to see the value of home healthcare and even the necessity of it, right?
Absolutely. And like you said, in today's environment, more care is delivered in the home. And I think that we were going in that direction before this happened, but the need is more present now than ever before.
So what exactly is home healthcare? What does it entail?
Well, it is a lot of different clinicians that would be visiting patients in the home, and those would be nurses and rehabilitation therapists, like physical therapists that can help with strengthening in the home. And then we even have remote patient monitoring. So when our clinicians can't go into the home, we have the ability to check in on them remotely through different forms of technology.
Hmm. What kinds of patients do you see in a home healthcare setting?
Lots of different ones. So I would say that it's everybody from little kids, and we take a lot of from our children's hospital, but we also have a lot of elderly patients. So really, everybody that needs care in the home, we can see them. Most of them are coming from a hospitalization, so they need help understanding maybe a new disease that they were diagnosed with, education on new medication maybe that they were given. So our clinicians can go to the home and help them with that.
Help them through that. We're hearing so much about the healthcare industry in general, needing people to fill so many critical roles in the delivery of care or the upkeep of the industry. What kinds of folks are you looking for in home healthcare?
Well, specifically right now, we are looking to fill 20 positions for LPNs, and that's the type of nurse that delivers care either in a home or in different healthcare settings, but they allow us a lot of flexibility in seeing more patients. We partner them with a registered nurse, so we have a consistent care team that goes into people's homes, and they're really great at education. Their skill set is such that it really lends to the work that we're doing in the home, which is a lot of education.
Hmm. So folks who may hear that and think, oh, that sounds like something that would be rewarding work. What kind of candidates are you looking for?
Well, when we look at the right candidate, I think of a couple different types of people, and one's a veteran, because whenever we deliver care in the home, we need somebody that can adapt to different situations, that is great at working with people, that is uh, maybe somebody that is passionate about education and healthcare. So if a lot of our nurses had dreams of becoming teachers,
Hmm.
and they found healthcare as a passion for them. So somebody that's great at education, somebody that's willing to adapt to change. We certainly know that in healthcare and in life right now, change is constant. So we need to have the ability to change.
The other thing we know in life right now is the idea of remote learning. Are you doing some training and additional teaching for folks remotely?
We are. So all of our orientation right now is remote in some capacity, and then we pair candidates with clinicians in the field. So we're able to provide a combination of remote learning and in-person training in the field.
All right, some terrific opportunities. And if you want to learn more about home health care, you may do so through Spectrum Health. We'll put a link to their website on ours at 13onyourside.com. Thanks so much, Steve, for being here.
Thank you.